Your doctor has diagnosed you with chronic lymphocytic leukemia, CLL, and you might be feeling confused, bewildered, or scared, like your world has been turned upside down. You might find yourself wondering, what is this exactly? How did this happen? How bad will it be? And how will I get through this? These feelings are normal reactions to any serious diagnosis. Coping can be stressful, and you need clear and easy-to-understand information to help you to regain a sense of control and understanding of what to expect. Cancer can be difficult to understand. Cancer is not just one disease. There are many types of cancer. Cancer can start any place in the body. It starts when cells grow out of control and crowd out normal cells. This makes it hard for the body to work the way it should. In all types of cancer, some of the body's cells begin to divide without stopping and spread into surrounding tissues. Cancer can be treated very well for many people. In fact, more people than ever before lead full lives after cancer treatment. CLL is a type of cancer. Let's take the time to give you some information about CLL that you need. Let's start with the basics, taking this one word at a time. Leukemia is a general name for cancers that affect the blood and the bone marrow. Lymphocytic means that this leukemia causes your body to make too many lymphocytes, a type of white blood cell made, like other blood cells, by your bone marrow. Your bone marrow is the factory that makes your blood. Red blood cells carry oxygen, white blood cells fight infection, and platelets clot your blood to prevent bleeding. Chronic means that this is a slowly developing disease, so it may take a long time before a person needs treatment. In other cases, it is more serious or urgent. The condition is called CLL for short. CLL is one of the most common types of leukemia affecting older adults. Older age is a risk factor for CLL. Risk factors increase a person's chance of getting a disease, although having risk factors doesn't mean you'll get that disease. Another risk factor for CLL is having a family history of CLL or other cancers of the lymphatic system. The white blood cells from the bone marrow and lymphatic system, which includes your lymph nodes, help to fight infections and make up your immune system. While increasing age, having a family history of CLL, and a person's ethnic background are thought to be risk factors for CLL, there is nothing you could have done differently to prevent this from occurring. CLL is often found by a routine blood test. People with CLL have too many lymphocytes. CLL doesn't usually cause any symptoms at first. People often say that they just don't feel well. However, consistent with the slow development of this condition, symptoms can develop very gradually over time. People with CLL sometimes experience painless swelling of their lymph nodes. In addition to swollen lymph nodes, other possible symptoms of CLL, in order of prevalence, are tiredness, infection, night sweats, excessive bleeding or bruising, weakness, shortness of breath, fever, and unintentional weight loss. Some patients also experience pain or fullness under the ribs. When speaking with your doctor or healthcare provider, you may hear the word B symptoms, which refers to systemic symptoms or body-related systems. These include fever, night sweats, severe fatigue, and weight loss. In CLL, B symptoms are usually a sign that treatment can start. CLL can sometimes cause complications, such as frequent infections. You might be surprised to hear this, as CLL is associated with too many lymphocytes. This is because CLL can confuse the immune system so that it doesn't function normally. The infections are most often colds and problems like tonsillitis, bronchitis, flu, and pneumonia. CLL usually progresses slowly, and many people don't need treatment at first. Some never need it at all. Treatment is started when there are symptoms or when blood tests show that the disease is progressing. With treatment, some people can go years before their CLL gets worse. Long-term survival with CLL varies between individuals, and depends on multiple factors. Some people with CLL will live for 20 years or more after their diagnosis, and others will only survive for a few years. In 2009 to 2011, the 5-year survival estimates for patients with CLL in the USA were around 82%. The 10-year survival estimates were around 65%. There are a number of different characteristics of your disease that may influence this, that your doctor will discuss with you. How well you will do depends on many things, including your age, your general health, what kinds of changes are happening in your blood and bone marrow, and whether you have developed changes in the DNA of your cells. It will also depend on how far the CLL has progressed when you are diagnosed, whether it gets better with treatment or comes back soon after treatment. Starting or maintaining healthy habits like eating a nutritious diet, exercise, and not smoking are a good way of coping with the physical and mental health demands of CLL and its treatment. Talk to your doctor about what you can do to maximize your quality of life. At the moment, you may have more questions than answers about your condition. This diagnosis can seem overwhelming. Your doctor or healthcare team are there for you and can address your concerns. It might be helpful to write down your understanding of your condition and any questions that you have for your doctor. If you have a trusted relative or friend, consider bringing them to your next appointment for support. Please talk to your doctor to learn more.